Today we're covering 9.PCH.3.2 content. It's all about first aid, CPR, Heimlich maneuver for what to do with choking, what to do if somebody is poisoned, somebody is burned. So it is a lot of information, and it is broken down into 3 different PowerPoints. Of course, as you can see, we just have a basic first aid PowerPoint, a CPR PowerPoint, and then advanced first aid PowerPoint. So I'm going to go ahead and go over the first one with you. So we'll get started for today. So this first one we're going over is just providing basic first aid for anyone, and we have 3 vocabulary words. Of course, it's first aid, Good Samaritan Law, and universal precautions. So the first thing to do is, if you ever find yourself in an emergency, know that first aid can save somebody's life. By learning simple first aid procedures, you can prevent the victims from suffering further and reduce their chance of injury and increase their chance of survival. So first aid is the immediate and temporary care given to an ill or injured person until a medical professional care can be provided. So the first thing is to recognize that there is an emergency. The next thing you need to check is to make sure the scene is safe for you to respond, because you're going to be in a worse situation if you respond to something and the scene's not safe and you injure or hurt yourself. You can't help anybody if you yourself are hurt. So you have the first 3 C's to follow: check the victim, call 911 or your local emergency number, and care for the victim. The first C is check the victim, of course. So see if they are unconscious or if they have life-threatening conditions and need immediate care. And you only move a victim if he or she is in direct danger. But in a regular situation, if the victim is in a safe scene, leave them there and wait and perform your first aid where the victim is until medical help arrives, because you could do more harm by moving the victim, especially if it's a neck or back injury. You could do more harm. So only move the victim as if they are in direct danger or continuing to be in danger by being on the scene. Of course, call 911 and stay on the line till help arrives. If the victim is in need of immediate care, get someone else on the scene to help you call 911 while you provide the first aid. And of course, care for the victim and care for them until first responders can arrive. And of course, if the victim refuses help, you need to respect their decision. And if the victim can't speak to give you permission, provide care anyway, because it could be a life-saving thing, or it could be a life-changing event. And of course, although first aid can help a victim stay alive, of course, it is very important to call EMS, to get professional medical care. We are just providing help in the meantime. So with that being said, most states, including North Carolina, has a Good Samaritan Law, and that is statutes that protect the rescuer from being sued for giving emergency care. So if you give care and it does kind of some harm, a lot of times there is a Good Samaritan Law to help you, because you are acting in the best interests of the victim at the time. You should always follow what they call universal precautions to provide first aid and medical care. So you need to treat all bodily fluids like blood, spit, saliva, stuff like that, as it could carry disease. So universal precautions, the definitions is the steps to take to prevent the spread of disease through blood and other bodily fluids when providing first aid or health care. So we have 3 universal precautions, and of course they are to wear sterile gloves whenever you could come in contact with somebody else's blood or bodily fluids, wash your hands immediately after providing first aid, and of course use a mouthpiece if one is available when you're providing rescue breathing and CPR. The first aid for bleeding. Of course, the appropriate first aid for bleeding depends on what type of wound you're dealing with and how severe the bleeding is. So first and foremost, let's go over the types. An abrasion can be a simple scrape. So it's the only thing with a scrape, it could get infected, it's going to burn, but it probably is not going to need medical care like at a doctor's office or stitches. A laceration is a cut caused by a sharp object slicing through layers of skin. So depending on how many layers it goes through will depend on if it requires medical care, stitches, and a tetanus shot. A puncture is a small but deep hole caused by a sharp, narrow object. The puncture, it has a very high risk of infection, so a lot of times medical attention is needed, and it may require an updated tetanus shot. And then an avulsion is when the skin or tissue is partly or completely torn away, and an avulsion is usually a very deep, so it's going to require medical care and it's going to require stitches. So when you treat an open wound or someone other than yourself, of course, always wear protective gloves because of not knowing whether the blood is contaminated. And of course, if medical help is needed, call 911 first, then wash the wound thoroughly with mild soap and running water. Follow these steps to control the bleeding. Of course, if possible, raise the wounded body part above the level of the heart, cover their wound with sterile gauze or clean cloth, and then press the palm of your hand firmly against the gauze to apply pressure. And of course, apply pressure to the wound for 5 minutes or until help arrives. Don't stop to check the wound. You may interrupt the clotting of the blood. And of course, so if you have applied gauze and it bleeds through the gauze, don't take that gauze off. Just continue to add gauze and apply pressure. And of course, once the bleeding slows or stops, secure the pad firmly and place it with a bandage, strips, or gauze or other material. The pad should be snug but not so tight you can't feel the victim's pulse. And if you can't stop the bleeding after 5 minutes, or if the wound starts bleeding again, of course, call for medical help and just continue to apply that pressure until help arrives. Bleeding from the eyes, mouth, nose, or ears can be a sign of internal bleeding. So, of course, call for 911, call for help immediately, because if it's internal bleeding, the victim may be going into shock soon. This is first aid for burns. Of course, burns can result from exposure to heat, flame, hot water, steam, sunlight, electricity, and certain chemicals. A first-degree burn only involves the outer layer of skin called the epidermis, and of course, this burned area just may become swollen and painful. A lot of time, a first-degree burn doesn't require any medical care. It's just make sure it doesn't get infected and it heals properly. It may burn and sting for a few days, but you'll be okay. Second-degree burns involve the epidermis and the underlying skin, which is the dermis, and this was when you develop blisters and there's severe pain and swelling. And then third-degree burn involves all the layers of the skin and penetrates through the tissues, underlying tissues. These burns can be so severe that they destroy nerve endings, so the victim may not experience as much pain with a third-degree burn as what somebody does with a second-degree burn, because they have killed the nerve endings. Here is the treatment for first and second-degree burns. Of course, cool the burned area by holding it under cold water for at least 5 minutes. If this isn't possible, immerse the burned area in a cool water or wrap it in cold, wet cloths. Do not use ice because it could cause frostbite and further damage the skin. And then cover the burn loosely with the sterile gauze and bandage. And then next, you want to make sure to give them over-the-counter pain reliever and make sure that, of course, no one is allergic to the medication. And then minor burns, a lot of times will heal, like I said, first and minor second-degree burns will heal without further treatment, though the skin may be discolored. Just check, make sure there is no infection and it doesn't increase in pain, redness, and fever, swelling. If that is the case, you want to seek medical help. Some second-degree burns and all third-degree burns, this is what you want to do. You want to, of course, call 911 and provide first aid until help arrives. Cover the burned area with a clean, moist cloth and do not remove the burned clothing unless it is smoldering. So, like if part of their clothing is burned but it's not on fire anymore, don't remove it. Only remove it if it's still smoldering and causing more burning. Do not immerse the large burned area in cold water because it could send the victim in shock. And of course, be prepared to give first aid for shock and loss of circulation because of the severe burns. That covers the first part of this PowerPoint. I'm going to go ahead and end this video and start a new one with the second PowerPoint. So go ahead, after you watch this one, make sure you watch the one about CPR.